Ramsay Hunt syndrome, herpes zoster oticus, reactivation of varicella zoster virus in the geniculate ganglion of facial nerve, seventh cranial nerve. It would result in facial palsy, ipsilateral facial palsy, and loss of taste because the varicella zoster virus have been reactivated in the geniculate ganglion of seventh nerve. So, otalgia or ear pain will be the first symptom, along with the tinnitus, vertigo, unilateral hearing loss, painful rash or vesicles or blisters around the ear or the auditory canal. Treatment for the Ramsay Hunt syndrome or herpes zoster oticus. First line is oral acyclovir, that is antiviral with the corticosteroids, prednisolone. So first line treatment is oral acyclovir with corticosteroids. If it lasted for greater than 3 months, then it is called the post-herpetic neuralgia. If this condition lasts for greater than 3 months, then it is called post-herpetic neuralgia. If this occurs, then give the amitriptyline or pregabalin or gabapentin or duloxetine. So in this case, Ramsay Hunt syndrome that has persisted for greater than 3 months, now it is called post-herpetic neuralgia. Post-herpetic neuralgia. So in post-herpetic neuralgia, we will give the amitriptyline or pregabalin or gabapentin or duloxetine. So here is another important note. Start with the oral acyclovir. Prednisolone should be started within 2 weeks of symptoms. If the rash and pain persist for more than 2 weeks, it's better to add on neuropathic agent for them, like the amitriptyline or gabapentin or pregabalin or duloxetine. They would be more beneficial than the prednisolone after 2 weeks of the onset of symptom. So here important to note is that you have to start with the oral acyclovir antiviral, and prednisolone should be started within 2 weeks. And if the pain and rash persist for more than 2 weeks, then better to add the neuropathic agent. And also these neuropathic agents would be more beneficial than the prednisolone after 2 weeks of onset of symptom. Acyclovir, that is antiviral acyclovir, will be up to 2 weeks and add prednisolone, and greater than 2 weeks and still pain, then add one of the pregabalin, gabapentin, duloxetine or amitriptyline. Another condition is the herpes zoster ophthalmicus, in which the reactivation of varicella zoster virus in the ophthalmic branch of trigeminal nerve. The last one, the Ramsay Hunt syndrome, there was the reactivation of herpes zoster virus in the geniculate ganglion of seventh nerve. But here the ophthalmicus, herpes zoster ophthalmicus, here virus has been reactivated in the ophthalmic branch of the fifth nerve, trigeminal nerve. Conjunctivitis, keratitis and painful vesicles around the eye will be presentation of this herpes zoster ophthalmicus. Conjunctivitis, keratitis and painful vesicles around the eye. Treatment here for this herpes zoster ophthalmicus include oral acyclovir along with the antiviral corticosteroid, for example the prednisolone. So this is the herpes zoster, herpes simplex ophthalmicus. In the picture, ophthalmic branch of trigeminal nerve is involved. Here is another scenario in which 40-year-old female presents with annular rash with scaly edges on his thigh that's slowly growing over 3 weeks, associated with general pains and aches. The likely diagnosis is Lyme disease, because here the lesion that has been described, annular rash with scaly edges on his thigh, this is the erythema migrans. And the likely diagnosis is Lyme disease, and appropriate investigation for the Lyme disease, antibodies to the Borrelia burgdorferi, and first line treatment is the doxycycline for the Lyme disease, but in the case of pregnant lady it will be the amoxicillin. If there is history of travel, prodrome, initially high fever and watery diarrhea and headache and myalgia followed by bloody diarrhea, initially watery diarrhea and followed by bloody diarrhea, then most likely is because of Campylobacter jejuni. And most cases of gastroenteritis due to Campylobacter jejuni are self-limiting with good hydration. However, if severe disease occurred due to Campylobacter, then erythromycin first are clarithromycin or azithromycin or ciprofloxacin. Here our Campylobacter means curved bacilli rods. It is a gram-negative on stool culture and sensitivity. So Campylobacter gram-negative bacilli rods and Vibrio cholera gram-negative comma-shaped rod. Streptococcus pneumoniae gram-positive, Diplococci and Staph aureus is gram-positive and coagulase positive.